A very good morning to one and all. Today we're going to discuss about another topic, that is epistasis. Epistasis means nosebleed. Let me introduce the topic. Epistasis refers to nosebleed or hemorrhage from the nose. Fairly common and seen in all age groups. It is most commonly originates in the anterior portion of the nasal cavity. So that is called epistasis. It is refers to nosebleed or hemorrhage from the nose. That is a terminology for epistasis, and it can be seen in all the age group, in children's and in adults and in old age also you can see in this one. And most commonly this bleed is occurring from the anterior portion of the nasal cavity. Okay, let us see the definition. A hemorrhage from the nose, referred to as epistasis, is caused by the rupture of tiny distended vessels in the mucous membrane of any area of the nose. So, any part of the nose it can occur. So, it is referred as a hemorrhage. Okay, a hemorrhage or bleeding from the nose, that is epistasis, and it is caused by, how it is causing, by rupturing of tiny distended blood vessels. When you are reviewing the anatomy and physiology, you can see that there are a lot of small blood vessels or capillaries present in the nose. So because of the rupture of any tiny blood vessels, or in the which is present in the mucous membrane of any area of the nose, that is called epistasis. Let us see the classification. First one, anterior epistasis, that are more common mostly from little's area. Little's area means that is the anterior part of the nasal tract, and in that area there is a mainly four arteries are present, small arteries are present. That is a bunch of arteries. That part is called little's area. You just review on the your anatomy and physiology book. Or anterior part of the lateral wall, mostly occur in children or young adults. Mostly trauma is the reason. Mainly it is occurring due to trauma. Either you are inserting something in your nose, or sometimes by nail prick, or while removing the crust it can occur. Usually mild, can be easily controlled by local pressure or anterior pack. So this is easily treated with the help of local pressure. If you are pinching the nose itself, when you are putting pressure over the nose, it can stop, or you can put anterior pike. Next is posterior epistasis. It is less common. So anterior epistasis are more common, and posterior epistasis is less common. Mostly from posterior superior part of the nasal cavity. So superior or upper part of the nasal cavity, it is, or from the sinus, it is occurring after 40 years of age. Mainly you can see in above 40 years of age. Spontaneous, often due to hypertension or arteriosclerosis. And the reason behind this posterior epistasis may be it is occurring spontaneously, okay, and due to hypertension or arteriosclerosis. Any blood vascular disorder can lead to this posterior epistasis. Bleeding is severe, requires hospitalization, and postnasal pike often require. So this posterior bleeding is there, then the person is needing immediate hospitalization, and also need postnasal pike. Okay, inside the nose we have to pike. Then this is the anterior versus posterior epistasis. You can see in that anterior, that is only in the front page on the nasal tract, and posterior means it will be behind the nose or superior part of the nose. Causes of epistasis. Local causes are dryness leading to crust formation. Mainly bleeding occurs with the removal of crust by nose picking, rubbing, or blowing. Usually in children's, or sometimes in young people also, we can see in that a habit of removing the crust from the nose with the help of finger. So while doing this one, there's a chance of, while rubbing or blowing, there's a chance of epistasis. Trauma, direct blows, then infections like viral rhinitis, nasal diphtheria, or acute sinusitis. These are the infection can lead to epistasis. And foreign bodies, including non-living, any neglected foreign bodies. Then atmospheric changes. Okay, we have discussed in before also, when height is changing, that time there will be some changes is occurring in the in our body related with balance or related with pressure. So high altitude sudden decompression, that can lead to epistasis. Then deviated nasal septum, that is a condition in that the septum of the nose is deviated, so that we will discuss later. So that in that condition also bleeding can occur. Then systemic causes are less common. Systemic causes are idiopathic. then hypertension, renal disease. Due to hypertension, it can occur, or renal disease. Then bleeding disorders, mainly aplastic anemia, leukemia, scurvy, or vitamin K deficiency. In this condition, epistasis can occur. Then liver disease, especially hepatic cirrhosis. Then drugs, excessive use of salicylates and other analgesics, and anticoagulant therapy. Anticoagulant therapy we are using for thinning the blood. So there is a chance of increasing pressure and bleeding can occur, or permeability will be increasing. So these are the possible causes. Let us see the signs and symptoms. Signs of excessive blood loss, which including because of the blood loss only the signs is occurring. The main sign is bleeding from the nose, and due to the blood loss you can see the person is having dizziness, weakness, confusion, and fainting. Okay, these are the symptoms which are related with blood loss. Let us see the diagnostic evaluation, how we can diagnose. History collection should be taken regarding the amount, including amount of blood loss, how much blood loss occur, duration of blood loss, then any medication history, sites of nose from where bleeding is occurring, either left or right, or any non-bleeding tendency in the patient or family, whether they are having any family history. Then careful inspection with nasal speculum. For this epistasis, you can use nasal speculum. It is an instrument which we are using for visualizing the nasal tract. It is very important to determine which site of bleed first. Then laboratory investigation, including a blood test for dyscariasis and coagulopathy. To identifying any underlying diseases, we can go for laboratory investigations. Then next is a management. First of all, medical management. In that, in any case of epistasis, it is important to know mode of onset, how it is occurring, spontaneous or fingernail trauma, how it is occur, then duration and frequency of bleeding, how long it is, then amount of blood loss, how much blood loss is there, side of nose from where bleeding is occurring, any non-bleeding tendency in the patient or family, history of any non-medical ailment like hypertension, leukemia, mitral valve disease, cirrhosis, nephritis, then history of drug index. So these are the main things we have to know before initiating any management. Then first aids, if it is in the little area, pinching the nose with thumb and index finger for about 5 minutes, compression of vessels. So if it is from the little area I told that it is anterior part of the nose. If it is from the little area, then we have to pinch the nose with thumb and index finger. With your thumb and index finger, we have to pinch. How maybe you know how to pinch. So pinch the area for 5 minutes, continuously for 5 minutes. It will compress the blood vessels and stop bleeding. Then Tortoise method, patient is made to sit leaning a little forward. They have to move little forward over a basin to spit any blood and breathe quietly from mouth. Cold compresses should be applied to nose to cause reflex vasoconstriction. So in Tortoise method, you have to make the patient in a sitting position. This is pinching nose. Then this is Tortoise method. You have to make them to sit in a proper position. Tell them to move little forward or lean forward, and we have to tell them to pinch the nose, and also you have to keep a basin under them to in order to drain the blood. Okay, this will help for breathing, and also it will reduce the bleeding. Then anterior nasal pressure with joint tongue depressors. With the tongue depressor also we can give the pressure. Then if first aid measures are unsuccessful, additional treatment is indicated. So first of all, we have to provide the first aid measures that we have discussed, pinching the nose or make the patient to sit and leaning forward. If it is not success, then we have to go for anterior nosebleeds. The area may be treated with a silver nitrate applicator and gel foam or by electrocautery. So this is a treatment we are going for anterior nosebleed. And topical vasoconstrictors also we can give. Vasoconstrictor will helps to constrict the blood vessels, narrowing the blood vessels, such as adrenaline or cocaine and phenylephrine may be prescribed. Let us see what are the measures we are going for anterior nosebleed. First of all, silver nitrate applicator, like it will showing like this. So in that tip of the portion, you can see that silver nitrate is applied, and this we are inserting into the nose. Then gel form, that is also another thing, absorbable gelatin. Okay, it's a gelatin. The once we have to insert in the nose, then it will absorb in itself in the nasal mucous membrane. Then, if the bleeding is occurring from the posterior region, if it is from the posterior or superior part of the nose, cotton plugets or cotton balls, okay, soaked in a vasoconstriction solution may be inserted in the nose to reduce the blood flow and improve the examiner's view of the bleeding site. So, in order to view the bleeding site, we have to stop, or we have to soak, we have to wipe the blood so that we can use the cotton plugets, which will be dipped in a vasoconstricting solution. Then afterwards we will wipe our area. It will reduce the blood flow. Then alternatively, a cotton tampon may be used. Cotton tampon or pad, okay, that we can use to try to stop the bleeding. Suction may be used to remove excess blood clots from the excess blood and clot from the field of inspection. So after keeping this nasal pad, that also helps to stop the bleeding. Then electrocautery. So that is a instrument which we are using mainly in the surgical conditions and all. So with the help of electric or with the help of heat, we can cauterize, or we can burn the burn means it's a kind of stopping. In order to stop the bleeding, we can burn the tissues. Okay. So usually in anterior epistasis, the first area is first anesthetized and the bleeding point cauterized with a bead of silver nitrate or coagulated with electrocautery. So with the help of electrocautery, we can seal the area, the bleeding area. First of all, we have to give anesthesia. Then we have to cauterize with the bead of silver nitrate. It's like you can see in that in operation and all, you can see that while making the incision, they are using the electric cautery, so it will both side of the skin will be burned or a little bit dried for in order to prevent the bleeding. When the origin of the bleeding cannot be identified, the nose may be packed with gauze soaked with petroleum jelly or antibiotics ointment. So, if the origin of the bleeding is still not identified, if you can't able to identify the origin, then what we can do is we can pack the nose with gauze soaked with petroleum jelly or antibiotic ointment. So, either petroleum jelly or antibiotic ointment we can choose for this nasal package, and we can keep inside the nose. A topical anesthetic spray and decongestant agent may be used prior to inserting the gauze package. In order to prevent the pain or reducing the pain or discomfort, we have to use a topical anesthetic spray or decongestant agent. The packing may remain in place for 48 hours or up to 5 or 6 days if necessary to control bleeding. So sometimes we can keep it for 48 hours or 2 days, or sometimes to 5 to 6 days we have to keep it for control the bleeding. So by the time we have to provide treatment for underlying conditions like hypertension or arteriosclerosis. Then antibiotics may be prescribed because of the risk of iatrogenic sinusitis. So there is a chance of entering of blood into the sinus tract. So we have to prescribe antibiotics in order to prevent the infection of or sinusitis. Then anterior nasal packing. If the bleeding is profuse and or the site of bleeding is difficult to localize, anterior packing is done. For this, a ribbon gauze soaked with liquid paraffin is used. Ribbon gauze means it's a long gauze without it is not cutting anywhere. Long gauze around 1 or 2 meter length will be there. Continuous about 1 meter gauze, that is a length is required for each nasal cavity. Then what we are doing means that gauze we are inserting with the help of the artery faucet, we are inserting into the nose, and after once the use is over, then we can remove with this, while pulling it will remove entire gauze. That's why we are using the ribbon gauze. Pack can be removed after 24 hours if the bleeding has stopped. If the bleeding is stopped, then slowly you can remove the gauze. So continuously it will come outside. Posterior nasal packing means it is required for patient bleeding posteriorly into the throat. If it is bleeding is going into the throat, there is a chance of aspiration. In order to prevent that one, we have to do posterior nasal packing. A post nasal pack is first prepared by tying three silk ties to a piece of gauze rolled into shape of a cone. So you can see in the picture, okay, three nodes you can see in that: posterior pike, anterior pike, and anterior ghost rod. So like that, three packages will be there. So with the help of this pike, you can do this postnatal pike. You will get the YouTube videos. You can search and you can see the video how they are doing the posterior nasal pike. Okay. Then next one is complications of epistasis, including hemorrhagic shock. So if the bleeding is not stopped or controlled, can lead to hemorrhagic shock. Septic shock can occur. Pneumocephalus means presence of air or gas within the cranial cavity. Then sinusitis and septal pressure necrosis. Due to the pressure over the septum, necrosis also can occur. So these are the possible complication of epistasis. Then neurogenic syncope during packaging, that is also a complication, also called vasovagal syncope. While you are packing that time, nerve compression can occur. It is a sudden drop in heart rate and blood pressure leading to fainting, often in reaction to a stressful trigger. So if more compression is occurring to the nerve, that can lead to abnormality in the heart rate and blood pressure. Then epiphora is an overflow of tears into the face. Okay, epiphora also can occur due to the nasal package. The nursing management, including the nurse, monitor the vital signs, assist in the control of bleeding, and provides tissues and an emesis basin to allow the patient to expectorate any excess blood. Emesis basin means vomiting, for vomiting purpose. It is not uncommon for patient to be anxious in response to a nosebleed. So usually normally the person will be, if it is happened to us also, we are more anxious. So it is not uncommon, it is a common thing that patient will be anxious, and you have to provide, you have to do, you have to monitor vital signs, and you have to assist the patient for controlling the bleeding, and also you have to provide emesis based on tissues. Monitor vital signs and assist with control of bleeding, assist for change in BP and pulse indicative of hypovolemia. So while monitoring the vital signs, if any changes is there, that will be indicative for hypovolemia. Then reduced fluid in the body. Then assuring the patient in a calm, efficient manner that bleeding can be controlled, can be reduced, then can help to reduce anxiety. You have to provide psychological support because patient will be in anxious because of seeing the nosebleed. So you have to provide psychological support that the bleeding will be controlled and it will be reduced. Instruct to the client to avoid blowing or picking nose after a nosebleed. I tell them to don't blow or picking the nose. Then discharge teaching include reviewing way to prevent epistasis, avoid forceful nose blowing, straining, high altitudes, and nasal trauma. So they have to avoid all the possible causes. Monitor the client with posterior packing for hypoxia. So we are doing when we are doing the posterior nasal packing, we have to monitor whether they are having any hypoxia or there is a difficulty in oxygenation. Then adequate humidification may prevent drying of the nasal passage. We have to teach them that proper humidification is needed. We should not allow the nose dry. The nurse instructs the patient how to apply direct pressure to the nose with the thumb and the index finger for 15 minutes in case of recurrent nosebleed. If recurrent bleeding cannot be stopped, the patient is instructed to seek additional medical attention. So, in the home setting, if bleeding is coming, we have to teach them to pinch the nose with the index finger and thumb finger at least for 15 minutes. It will help to stop the bleeding. And if it is not stopped, then they have to seek the or they have to reach the nearby hospital or medical attention. So this is all about the topic epistasis. It is important for your exam. So epistasis is simply it is a nosebleed. It is mainly occurring in the anterior part of the nose, and mainly it is due to the causes will be trauma or any kind of changes in the pressure or arteriosclerosis or hypertension. Then we have seen what are the types of bleeding. Then what are the causes, signs and symptoms, how we can manage or treat the patient, and what are the possible home remedies, and what all things they have to avoid in order to prevent nosebleed, or what all things they have to follow, and what are the medications for nosebleed, and how we can manage the nosebleed. Okay, so this is all about nursing management also we have seen. So you have to make the notes, and if there is any doubt you can ask me. I hope all of you understand about today's topic. Have a nice day. Thank you.